Jennifer Haberkorn is a senior healthcare reporter for Politico. She joins me now from the Politico newsroom in Arlington, Virginia. Thanks for being here.
Thanks for having me.
So, Jennifer, explain what the president is threatening to do with these tweets.
There's two things going on here. There's about $7 billion in funding to insurance companies that the president has the power to pull at any moment. This is funding that was supposed to go toward the implementation of the Affordable Care Act. Now he could pull that money, and insurers are very worried about that because it would destabilize the market. The insurers argue that without this funding, they would have to increase premiums. They actually have the power to leave the market almost immediately. It would create chaos. The other thing he's threatening here is the government's contribution to members of Congress health insurance. Most employers pay for a portion of their employees' health insurance. The same thing happens with the federal government pays for members of Congress health insurance. I should say a portion of it. So he's threatening to take that away. Both of these things are, pretty powerful, both to insurance companies and to members of Congress. And it looks like the president, really wants to go after this funding, after this employer contribution, to get some movement on his top priority, which is Obamacare repeal.
Jennifer, how is this threat from the president being received by lawmakers on Capitol Hill?
Well, this has happened over the weekend when lawmakers are at home. House members are out for the recess for August. Senators are coming back to the Hill today. So there hasn't been a ton of response to their employer contribution, but they are very worried about these cost-sharing subsidies, this insurance company funding that we talked about, because it would have such an immediate effect on their constituents and on their health insurance. They don't want to see this funding go away. Senator Susan Collins said over the weekend that she really thinks this funding should be restored immediately. There should be stability for the insurers. And a lot of other members of Congress feel the same way. They feel like, this is an unnecessary instability that the president is causing by hanging this over the heads of insurers.
A lot happened over the weekend. Counselor to the president, Kellyanne Conway, said in an interview yesterday that the president would decide this week whether to continue Obamacare's cost-sharing reduction payments. So what would happen if he decides to end those payments?
If he ended it, it would be an almost immediate impact. That's because insurance companies negotiated into their last contract that they could leave the markets almost immediately if this money goes away. Whether they would actually do so is another question. I mean, they would have customers who'd be very concerned. It would have a bad PR effect on them. But just because they have the power to do it creates just this atmosphere of uncertainty. And, the Affordable Care Act has been under uncertainty for a very long time, most specifically the last 6 months as Republicans have been trying to repeal it. And now that this repeal effort, appears to be dead in the Senate, insurers just want to move forward. They just want to sell their policies, and, customers just want their insurance to continue. So it's a pretty hairy situation, to say the least.
Meanwhile, we do know that a bipartisan group of about 40 lawmakers are planning to unveil a number of Obamacare fixes today. What can you tell us about that?
So the key priority for those bipartisan lawmakers is this cost-sharing money, because of the reasons that we've already talked about. But I think what's going to be interesting to watch is, can both sides actually get out of their defensive positions on the ACA. Republicans have been against it for so long. Democrats have been defending every piece of it for so long. Can they actually move forward and put forward ideas that the other party can actually get behind? There's some Democrats who are talking about single payer. That's a non-starter for Republicans. Republicans have already said, they don't want to bail out insurance companies, meaning they don't want to fund this program. Can a very large group of lawmakers, enough to pass legislation, get behind ideas that the other party can actually support?
Jennifer, before you go, I want to ask you one other thing about the White House's new Chief of Staff, John Kelly. What are you hearing from lawmakers and aides? What did you hear over the weekend in terms of their reaction?
I think they're pretty open to the idea. I think the difference between Reince Priebus, the last Chief of Staff, and General Kelly is that Priebus had a lot of connections on Capitol Hill, whereas it doesn't seem like General Kelly has as many connections. You could argue that those connections didn't really help the former Chief of Staff. They weren't able to pass repeal of the Affordable Care Act. But you know, at least it wasn't a cold call conversation. There were some relationships there. Whether General Kelly has those relationships, I think, is yet to be seen.
All right, Jennifer Haberkorn of Politico, thank you so much.
Thank you.